Hi everybody, and in this video we're going to demonstrate a HVLAT manipulation, which is actually a safe manipulation to use when somebody presents with a potential disc bulge or compression on the L5-S1 nerve, and they may be experiencing pain along the distribution of the sciatic nerve path itself. So to demonstrate this technique, for the assumption of today, we're going to assume that the patient has pain along the distribution of the sciatic nerve on her right hand side. So this will be pain in the lumbars, in the L5-S1 area, possibly into the gluteal, tracking down through the hamstring and or anterior foreleg, posterior foreleg as well. So what we're going to do is ask the patient to turn towards me, having the pain side uppermost. So if possible, we will straighten the lower limb. We'll flex the knee, placing the dorsum of the foot across the distal end of the gastroc or calf, placing one hand onto their hip, holding that in position. I'll clasp above their elbow, and what I'm simply going to do is place my pads of my fingers at L5. I'm going to rotate through L5 if they can tolerate the rotation. We're trying to keep the body in as neutral a position as possible, and because we have slightly more flexibility, we're going to ask the patient to clasp their own elbow. If they were slightly thicker, as in barrel chested, you may have them clasp their own wrist, but for here it's going to be the back of their elbow. Now normally we would manipulate from this side of the couch, but this time what we're going to do is transfer around to the opposite side. I'm going to use the palmar aspect of my forearm across the pectoral fossa, stabilizing the hand and elbow in position. I'll ensure the patient that they're not going to fall, because they may feel as they may fall as you rotate them towards the edge of the table. And from here we place our thumb across the iliac crest and our hypothenar towards the PSIS. We simply compress and hold the upper. We're not rotating backwards through the uppers. We fixate on the upper, keeping our own back up nice and straight, and we compress their pelvis away, gapping the L5-S1 space, giving the sciatic nerve, or one of the roots of the sciatic nerve, some breathing space. We simply compress, compress, compress. You can do this until the symptoms abate, or on the third or fourth compression at the end range we can apply a 45-degree HVLAT manipulation along the line of the femur. So compress, compress, compress and thrust. And there we have it, guys, a nice simple L5-S1 distractionary technique that's safe to use if someone is presenting with a possible disc bulge at L5-S1.